public comment. We will have our COVID team come up and update us and share with us what is going on. Welcome. Good morning.
Good morning. Thank you, Madam Chair. Marcy Hudson, Public Health Nursing Director. I'll start with our testing numbers today. This morning we have tested, we have 1,183 negative tests. We have 5 positives with 4 resolved, 154 are pending, 2 currently in isolation, 1 currently in quarantine, 28 total quarantines to date. We are looking at always improving on our data that's public facing to help our residents understand the picture. What we'll likely be adding is a running total of isolations as well. I think it's important. We get a lot of questions about whether or not this illness has gone through Trinity County already in March. That scenario, although possible, is probably unlikely. And there's a variety of reasons for that. However, I'm not going to go into a lot of detail on that. I'll certainly address that as it comes up. Probably the best thing to look at is a combination of our positives, the numbers of people in isolation and running totals of isolation, as well as quarantine. I don't want to put too much of a high point on the positives because there are examples of positives that occur in other counties that impact us. They may be positive in another county, but when they come back to Trinity County, they'll be isolated in our county. So those numbers aren't necessarily correlated. You might see higher numbers of quarantines, isolations than you would to positives and wonder why, and that's why. Perfect example of that is inmates coming back to Trinity County that may test positive in the county that they reside in the prison. That's their address. And so...
Marcy, I'm getting notes that Marcy is muted. I'm sorry, Marcy.
No worries. Thank you.
Thank you.
Try it now, see if we can hear it.
Can you hear me?
Well, we can hear you, but I
Oh,
don't know.
It's a Zoom that could not.
Oh.
We can hear you now.
Okay, great. Should I start over then?
Yes.
Okay. Let me go through the testing numbers. 1,183 negatives, 5 positives with 4 resolved, 154 are pending, 2 currently in isolation, 1 individual currently in quarantine, and there were 28 quarantines to date. As I stated a moment ago, we are looking at improving our public-facing data to give our residents the highest degree of information we can and be as transparent as possible. One of the things we're going to be looking at is including a running total of isolations. We want our residents to look at not just positives, but the numbers of isolation, individuals isolated as well as quarantine, due to the fact that the positive rate and isolation quarantines are not directly correlated. You may have times where you have individuals that are isolated that are not related to a positive case in Trinity County. They may be positive in another county, come back to Trinity County. And the perfect example of this, as I stated, was state inmates coming back to Trinity County who are tested prior to release, may be positive, and they come back. There's still some scenarios that may be included that I'm not addressing. We're trying to work out the issue with testing inmates and have those inmates isolate where they are rather than coming back to Trinity County. So I'll keep you all abreast of the data and how it's evolving and how to interpret that. The other issue I wanted to bring you up to speed on, first we'll talk about the testing sites and then some of the challenges around testing, as I'm sure you're aware of. Our residents can go to our trinitycounty.org website. If they click on the mobile testing link and click on more information, that will take them. They can click on the link that says monthly schedule for testing sites, and that's posted on our website. And I'm happy to answer any questions about that. I wanted to get to some of the challenges around testing to bring you up to speed. As I'm sure you're all aware, nationally as well as statewide, there are challenges around testing. One of the significant challenges is the long wait time. This is due in part to capacity at the labs, as well as a lack of rapid testing broadly available to counties, and also some delay in the delivery chain of specimens getting to labs from our Verily site. One of the things we're looking at is it more expeditious to actually transport those specimens from Verily sites to the airport in Reading where FedEx takes off to take those? Otherwise, they're transported by ground from us to that site in Reading, and for whatever reason, there's a delay in the reporting. However, I want to be clear that we've only seen an improvement in the one time we took them to the Reading Airport. Those results came back within 4 days. So we're not sure if that's just a fluke or if that is indeed a way to address this problem while we're trying to shore up other areas. One of the other areas we're looking at is looking at transporting or shipping tests to the San Francisco lab, public health lab, that's available to run many tests for several counties. I'm sure you remember Governor Newsom discussing that several weeks ago. We're also looking at our Shasta Public Health Lab, which we utilize. It is our public health lab, as well as a handful of other counties, and so we're looking at getting a good idea of how many tests they can take for us. The reason we're really concerned about the turnaround time is that we have, in one particular positive case, by the time we got the results, they would have already been out of isolation. That is a significant problem. It is not just a problem in Trinity County, this is a problem with many counties. I've heard on many calls with state health officers and public health directors that they're facing the same problem. That really renders contact investigation useless. We still do it to try to identify where the person may have got it and to try to ensure there's not community spread, get people tested that have been in contact with the positive, but you can see why it creates a challenge. The other important challenges this creates, and the reason we need to be able to work with the testing task force in California and our partners, is we've stood up a task force for jail testing staff on a regular ongoing basis and inmate testing. We're looking at partnering with Siskiyou. They do their jail health in their public health department, and they have nurses that will come and assist us. We're in the early stages of that planning. We've set up a task force with the schools, to meet regularly, weekly, as well as our MAC meeting to coordinate with partners. The school task force will be looking at the regular ongoing testing of teachers and staff as a surveillance mechanism to capture when any individuals are positive and how to respond to that. The school is, the health officer and myself are very concerned about schools. There is no appetite to keep kids out of school in our rural community. It's very challenging for them to be out of school. It's going to be challenging for them to be in school. We want to reiterate how important it is to have strong mitigation plans in the school, and we are working with the school leadership to do that. We are also working with the hospital to continue testing of skilled nursing facility residents, hospitalized patients, and we're working with hospital leadership, Aaron, Dr. Harwood, and Belen, to address rapid turnaround for testing of surgical patients. You can imagine waiting for a test 7 to 14 days on a surgery patient is problematic and primarily useless in that scenario. So we're also working with the hospital to be able to do that. We transport specimens down to Shasta Lab. We will do that with those surgical patient tests as well. The only last thing I wanted to mention, again, I feel remiss if I didn't do this every time I'm up here, is to once again plead with our community members. Every single individual in Trinity County has a responsibility not only to ensure schools open and businesses open, and that we can prevent the spread of this virus in Trinity County with all the challenges we're facing around testing, around potential surge of our hospital. We know from experience that these simple things work. Wear a mask when you are outside, when you are inside, within 6 feet of people, especially if you're inside, because the circulating air can carry the virus if there's not sufficient air exchange with the outside or a filter. Please, businesses, adhere to the guidance that the governor has set out. Bars, restaurants, I can't say that enough. Simply washing your hands on a regular basis. We can't emphasize that enough. We all want our population to be protected, and we want to get back to normal. We can see all around us what this looks like. That's all I have. I'm happy to answer any questions. I know Christy's going to talk a little bit more about businesses and what we're doing to assist them with compliance.
Supervisor Groves?
I don't really have a question, but I do have a statement for you that I went down, I drove past the testing down at the Performing Arts Center, and they looked bored, and I said, well, I'll just go down and get tested. And I didn't have an appointment, I forgot that you had that. But they were very gracious, and they took all the information and went through the process. And I just want to say, to the people that it took 20, 25 minutes. It's not painful. It's not a big deal. They're very nice and helpful to you down there. So don't be afraid to be tested. And thanks for those guys who are doing good work.
Thank you so much, Supervisor Groves. We really appreciate it. It means a lot to hear that coming from our supervisors. Just a caveat, people can actually get a same-day appointment. So we have people assisting them and enrolling. They create a pseudo Gmail account, so people don't even have to create their own Gmail account. It's just for that purpose. So thank you so much.
That's what they did for me, and they took me right in. So
Awesome. I'm so glad to hear that. Our team has worked very hard on that.
Supervisor Groves?
I do. Hey, thank you for addressing that gap problem between testing and results back. I know we talked briefly about it last meeting, so I'm glad you're pursuing some avenues that will help with that. And, maybe you can clarify something for me. I'm a little confused. All of you went through the trouble of the whole attestation process, and we were able to open. I believe that was late May. And I don't believe we skewed off of those numbers that you laid out, or your departments laid out. But now we're in this one level where restaurants have to serve outside, straight bars are closed. I think those are the two main ones. Certainly we're not anywhere near having group functions, and so I do understand. Has the governor come out and asked why counties who are adhering to their attestation are still having to go into this new mode? And being in the new mode, what are the benchmarks to put us into the state monitoring phase, which we want to avoid? So can you address any of those?
Sure, let me start with the first question. So the first question regarding the attestation, back when, before we had continued rising cases in California and deaths, when you look over the last 2 weeks, 3 weeks, a month, and look at the death rate in California and the number of cases in California and all around us, as the cases continue to go up exponentially and the deaths continue to go up, the governor, rightly so, stated that all counties in California will do the following. So with that said, that's where we are with the closures. Regarding the second question about the conversation, whether or not there are, let me make sure I understand your question, Supervisor Morris. Is there any discussion about counties that don't have, no, you asked about, I'm sorry, you asked about the monitoring list. Is that correct? What data we have to get on the monitoring
Well,
list?
we want to avoid that list, and I want to make sure, we're not close to those benchmarks.
That's exactly what the health department does every single day, is to keep us off of that list.
So is it a matter of cases? I mean, I think the public is concerned, because I understand if we do get on that list, schools also close.
That is not actually correct.
No?
So there are nuances to this. The monitoring list is you have to exceed a certain positive case rate, right? So you have to exceed a certain case rate over a period of time. So you have to hit a threshold of cases, and then you have to stay there for 3 days. That gets you on the monitoring list, for example. Now, to get off of it, you have to decline and maintain that case rate. With regard to closing schools, there's a little bit of a difference between the way schools are handled and the way that businesses are handled. There's a number of caveats to the school closure. I don't have those memorized, but but for example, elementary schools, if there are, any school, if there's 1 or 2 cases in the school, so there's a threshold for how many cases in the school, how many cases in the district, that guides when we would recommend closing schools. There's a waiver for elementary schools, so that's a component in that mix of the health officer allowing a school to stay open under a waiver in the midst of spread and what that looks like. Certainly children that are positive or at risk because of chronic health conditions, they would have to be excluded from that situation. So there's a number of nuances, and I hope that answered some of that question for you.
It does, thank you.
Supervisor Finley?
No.
Do you have any question? Is Supervisor Finley join us?
It will be joined as well.
So, thank you, and one quick comment, and perhaps Ms. Hamilton can clarify this. We were on a CAP board meeting, it was last week, and I believe it was Elizabeth Kelly from another county that we CAP. The county she represents made the naughty list, and she was informed that, and please follow up on this, but my understanding is that once you make the naughty list, you will not come off the naughty list. So that might be something you want to look into. The pooling data, you were going to begin doing small pools of people. I was wondering if we have done that and how that is going to expedite the time. And then earlier today, so you might not have gotten it yet, Mr. Olmsted, who may or may not be on the line, I would like to find out. He had some questions regarding understanding the website. So if he's on, I'll have him address that. If not, I'll read you his questions. But the pooling multiple people at one time, have we begun that, and what is the success of that?
That is not available yet through our Verily testing site. That the pool test is offered, it's my understanding, it's offered by a specific lab. And so far, and we ask this question almost every day. We keep our fingers on the pulse of all those threads, but it is not available in that testing site yet. And that's, unfortunately, that's all I know, but as I know more, I'll certainly let you know. I'll update you every week.
That would help our time frames, right?
Yes, it would help some. It would help some because it's a small pool, but it would increase it. Yeah, it would, depending on where the chain breakdown is and what's causing that. As I said, there's a few places that this is impacting testing turnaround, but pool testing is definitely one that will help in lab capacity. Yeah.
So is Rick on Zoom, or can you tell? I'll just go ahead and read it. It's actually easier because he took like cut and paste So this is his comment, see there? Okay, the stats on the coronavirus are getting confusing for me. Maybe you can help clear this up for me. First, according to the chart, we have 5 positive cases and 4 resolved cases. So that means 9 total cases, right? Question mark. Second, 2 in isolation and 2 in quarantine. So that means 4 more cases, which bring a total of 13, right? Question mark. Third, does isolation mean they have the virus and are they already counted in the positive? Fourth, quarantine, does that mean they have it and they are counted as well? Question mark. The terminology of the chart is what is throwing me off. The reason for the question is last night, 8/2/20, on the new Action News on 7 at 600, showed a map with 9 on our county map. Now there is a website that is COVID-19 alert, coronavirus disease in Trinity County, California, and they show 6 cases. Now our chart as of today, that was early this morning below, shows 5 cases. So help me in this dilemma. So some of these questions, I think he laid it out really good. I get as individual questions. And so I thought while we're on Zoom, I know there was a lot in there. If you could address them, I did address them on an email back earlier, but for the general population, can you explain how we have 5, that's the total, 4 resolved means those numbers, and I'll let you go.
Yeah, thank you so much. Thank you so much for that question. This is a part of the process. We rely on the public to ask the good questions like that, to always ask any questions of us, because we always learn. So one of the things I'm finding from listening to those questions, we're always looking at, is this really telling the public what we want them to know? Is that what this data is doing? We're starting to find out that that may not be the case. I can see where it looks like 9 total. It didn't really dawn on me until I heard it in the way he asked it. We will fix that. So there are 5 total positives, with 4 of those having resolved. So I think we need to correct that and make that a little more clear. With regard to the others, we may need to put out a press release to bring people along and remind them. So let me just reiterate here. Quarantine is for people who are not positive, they don't have symptoms, but they've been exposed to someone. So that's what quarantine is. You can have a large number, and you will with this virus. You could have 10 quarantines to 1 positive, depending on what they were doing. So there will not be a direct correlation for every 1 positive, you'll have 1 quarantine. So that's quarantine. Isolation is a little different, but may not correlate. Isolation is for people who test positive or who have symptoms and have been exposed. So we want to isolate them. It's a little stronger than quarantine. They must stay home unless it's an emergency. Those individuals, you could have a number of isolations and 1 positive, because we're only counting right now lab confirmed positives. So you could have a lab confirmed positive, but you could have someone who's not tested, who has symptoms that we're isolating. We're not technically calling them a positive because they haven't been confirmed by a lab. Now, the other thing we're looking at, though, is do we want to follow suit with other counties and count presumed positives, which is they have symptoms, they're not, for whatever reason, going to test, don't want to, for whatever reason. You can also use presumed positive in the absence of a lab confirmed test as a case definition. So we're looking at that now that we're getting larger numbers and we're seeing some confusion. So we're going to look at how we put that data out and maybe explain it a little bit better. But you will not see a direct correlation necessarily with the positive cases and isolations and quarantines. you want to take all three of those in the context of the virus activity in Trinity County to look at what's going on, because whether it's quarantine, isolation, or positive, all of those categories mean that the disease activity affected those persons at some point somehow.
Thank you.
I hope that helps.
It does, and where would the public be best to email any questions specifically on COVID? Where would you like to instruct them on Zoom to go to?
Yes, I'm so glad you asked that, because I tend to not want email to myself directly because I don't want to miss it. The best way to do it is through the trinitycounty.org website, and I think I'm going to ask Christy to explain the link because I'm not sure I'll do it well enough, but that's the avenue to email. Those come directly to me, and they're alerted in a way that I tend not to miss those. And I want to reiterate, that's so important. We really want our public to do that. That's how I get a lot of intel, and what changes our policies and the way that policies around data and things like that, not the way that we respond to an illness, but also with what's going on in the community and how we can message. So that is so important.
Well, I did forward this from Mr. Olmsted, so you'll be able to.
Terrific.
Yeah, he did a really good job.
Yes. Yes, and the Action News piece, we know they misreported, but again, it's on us to look at, okay, people are misreading the data we're putting out, so we need to correct that.
Yeah, thank you.
Thank you. Christine, thank you.
Supervisor Brown has joined us also.
Good morning, Supervisors. As you know,
Good morning.
Good morning, Dawn. As you know, as we go into several months of COVID response, a lot of our businesses are struggling, and it did not help that we had a bad news story throughout California telling some businesses that they could reopen when they were not allowed to since our last board meeting. And that made it really hard on those businesses because they got their hopes up, they started preparing to open, and they got the call that they were not allowed to. And from that, I really want to remind the public that it's county specific. I mean, we're being ordered statewide, but always check with the county first. Also, from this, we've been taking a multiple prong approach to outreach, education, really trying to get information out there to businesses. We had a team out doing these surveys and kind of telling us where we stand as far as businesses complying with the COVID masking, social distancing, etc. We felt this was really important because we were receiving a lot of complaints from many people that were directed at certain businesses. We didn't think we'd get an overall picture without going to every business and doing that survey by a neutral party. From that information, we were really able to figure out where those hot spots of non-compliance are, and that was really good information. As you know, COVID-19 is a very divisive issue in general, and we have both sides of the public complaining that they're closed and they don't think there should be any regulations or any mitigation measures, and then we have the other side that wants us completely closed down, no mitigation measures, just everybody closed. And I want to reinforce that we really need that middle ground. We want to stay open, but we got to wear our masks. We got to do the social distancing. From this standpoint, we've been working closely with several. We've been working with the chambers, working for joint messaging. You guys will get to see that in the newspaper. That's a big thank you to HHS on that. And I just really want to push that we're trying all these different ways, but it's not exactly working. And we're going to have to start trying other options. And we've been handing out masks to every business, handing out hand sanitizer, going down these surveys, reinforcing, educating, promoting. So we're trying every way, but we are still failing to get compliance in some areas and some businesses. So, just wanted to tell you guys that update, kind of give you some information. I'm sure you guys hear the same complaints as I do. And because of that, I'm forthcoming in how I have been approaching it. Any questions?
Any questions?
Yeah, thank you. I know it's been ongoing for all of you, and is Christy getting any extra help on the street? I just feel like you work 24/7, but I could be wrong. Hitting all the businesses and trying to follow up on all the complaints. So thank you. And is your approach of warning businesses, and then is there another level you get to take it to if they're just not complying?
Yes, and we've tried education and outreach, and we're
Yes.
really pushing that. But if we don't start seeing some results, that things will have to change.
Because I do get complaints from other businesses who are complying, and of course,
Yeah.
saying so-and-so is not.
And it's not fair to the people that work there, because if you walk into a business and you're not wearing a mask, you're not protecting those workers.
Right.
We need to care about each other as a community, and it's very important.
All right, thank you for your work.
Supervisor Brown, do you have any questions?
No, I have no specific questions. Yeah.
Well, I want to tell you that I was in attendance at the Trinity County auction, and I'll talk more about it later in the reporting out, but you were mentioned and in a very positive way, and the youth that attended and showed, the chairs were spaced out, there were masks on every chair, people were very cognitive, the auctioneer was very polite in his broadcasting, and they recognized you in a positive way multiple times, and just your availability to be aware of the importance of that for our county. And it was more than just the financial benefits. Our youth have been, they've been deleted from their proms, so many things. Some of these kids were going on to college, they're not going to be able to recapture. And so that day was really special. And you were recognized in your part on behalf of Trinity County. So you should know that. And you should be very proud of yourself for the measures that you took, were recognized, and they were abided by. So thank you very much on behalf of the FFA and 4-H and all those in attendance. We really appreciate it. Thank you. Yes.
Madam Chair, on the chat line, we have somebody saying that they can't hear us very well and cannot especially hear you.
Okay, well, earlier I was talking too loud, so.
And then we also have another question, that somebody that got tested, and it took 6 days to get it back, but then wanted to get tested again, but wants to know why they can't do it for 6 weeks.
So is that a Marcy?
That's a Marcy question, and because you brought that part up, I just wanted to bring up that on the main website, I'm getting feedback, sorry. On the main website, you can go and click questions, or you can go directly to reopen business at trinity.org and ask any question. And if I can't answer it, I will forward it to public health.
Thank you. Marcy, you want to come up and answer that?
I'm sorry, Supervisor Gross, could you repeat that?
This is somebody that got tested. It took 6 days for them to get theirs. Says it wasn't ideal, but it was fine in the process. I'm doing it again this week, about 6 weeks later, because why not? About 6 weeks later. Oh, I'm sorry, there wasn't a question.
That's okay, but let me just, because I was prepared for this, I wanted to just share that persons can get tested through our Verily web, test drive-through site. The only as many times as they want, but they can't get tested before their results come back from the current test, so.
Is there any delay once somebody has been tested positive? How long, is there a specific time frame that you recommend waiting till they're tested again? I think that was sort of the question that was there.
So that's a little challenging to answer because if they've tested positive, there's no indication that, we don't really know yet if people can be reinfected. And so if somebody tests positive, there's a time where those, where it will still show up positive, and depending on the test. So I'd have to know more about the specific scenario that someone who tested positive through a molecular PCR, the one that determines if you have the bug right now, the virus. Certainly serology testing would be something someone would do later on if they were positive, when that becomes available. It's not broadly available yet. So I hope I answered that to some degree.
To some degree, thank you.
Yeah, I would need to know more about what specific, more about why someone who's testing positive with the virus is going to test again if they're concerned they're reinfected. So that would just be discussions we would have and see what the recommendations are on that.
Thank you.
Yeah.
Is Ms.